Firstly, thank you everyone for joining. My name is Jihoon and I'm the chiropractor for Complete Corporate Wellness. So before I begin, I just wanted to point out that today's webinar is part of our wellbeing series webinars, and the website is going to be available in the chat for future webinars as well. So most of my patients, like yourself, are busy office workers who really struggle to find time to find time to do stretches and stuff like that. So today I wanted to make it a very quick and easy stretch routine, mobility routine, to kind of remind you how important it is to do things like stretching and moving around in our office space. So before I show you the stretches today, if there was one kind of key message that I would like to tell everyone, would be balancing opposites. So that's the main message I have, is balancing opposites. Now, what do I mean by balancing opposites? So obviously, when we sit down a lot, especially for office workers like yourself, when we sit down a lot, there's going to be certain positions that our body is in for a long period of time. So, as an office worker, that's sitting down predominantly. And to be specific, it's sitting down in our kind of office laptop situation. So it's very commonly, it's going to be this kind of posture, right? Where our elbows are, kind of bent at our table, our wrists are forward, our neck is kind of forward. And as you can see, my upper back is kind of hunched and my neck is forward. So this is a really common and typical position that office workers find themselves in. And for me, when I think about the human body, it's always about trying to balance out all the things that we do during the office time, to try to balance out by doing some stretches and exercises to help reverse what is going on. So the first one is, as we can see, when we're in this sort of position, the first thing that happens is our neck goes forward, right? And our shoulders are rolled in. And you can see how there's a bend in our elbow. So over time, if we do, let's say, 5, 6, 7 hours of this every single day for a long 10 years, 15 years, you can see how things are going to start changing, where our shoulders become tight, our neck muscles kind of go forward like this, and our spine in through our upper back is going to get really stiff as well, because obviously we're not moving around as much as we would like. So the first stretch I'm going to show you is all we're going to do is with our hands, what we're going to do, our kind of index and middle fingers, we're going to place behind our neck, right? And all it is from here is you're going to slowly pull your fingers forward like this, right? Kind of like you're scraping your neck. It's like a little massage, right? You're going to scrape forward and then you're going to just slowly look all the way up like so, right? And there's no rule to how hard you go. This is all personal preference kind of things. But what this is trying to do is, one, relax some of those muscles that become tight in our neck. But also, it's like a good reminder for our body and our neck that we can look up, right? Because we do so many of the things that we do, looking at a computer, looking at our phones, reading, so many of the daily activities that we do is looking down. So what this is doing is to make sure that we remind ourselves looking up is super, super important. So that's like the first area that we can kind of work on, right? Second one is going to be for our upper back. So like I mentioned before, our shoulders rolling forward like this, our neck forward, and our upper back, as you can see, becomes really, really rounded. And, stiffness comes from the lack of movement that we do throughout the day. So the next one we're going to do is we're going to interlock our fingers behind our neck. That's it. And then all we're going to do is we're going to just open up like this. And then all I want you to do is practice really pulling your elbows back as far as you can, right? And the lower you go on your base of your neck, the harder you'll get. So the higher it is on your skull, it's a bit easier. But as you guys kind of go down towards your base of your neck, you might find it a little bit harder and harder to really open up, right? So try to play around with the different positions of your hands. You guys can also add breathing to make it a little bit deeper. So what I mean by that is, if you breathe in, and as you breathe out, if you really try to extend your shoulders even more, you guys can maybe feel just that, centimeter or two of a deeper stretch in through that area. And especially for the middle back, it is really important that you try to get some movement in through there, because if the middle back is stiff, your neck is going to become stiff, your lower back is going to become stiff. It's kind of in the middle of everything, right? So it's really, really important to make sure our middle, our thoracic spine, our middle back is nice and flexible. So that's 2 easy stretches that we can incorporate already at our desk, and we don't even have to get up. So that's 2 right there. Third one, this one is one of my favorite ones that I advise all my patients to do. And it's like a combination of a neck stretch, an arm stretch, and a chest stretch all together. Same thing, balancing opposites, right? Same theory, we like this a lot, right? With everything kind of compressed and tight in through this area. So this one is to try to open up everything that we are doing a lot of. So this one, we need a little bit of a wall space, right? I prefer to do this standing up, but for today's demonstration, I'll just do it sitting down. All we're going to do is we're going to place our hands on our wall, right? And it's really important that our fingers, if we can, they're going to point down towards the floor, right? Our fingers are going to point down towards the floor like this. Elbows are straight. And then what we're going to do is we're going to turn our body and our whole torso away. You should feel this stretch all the way from your forearm, your wrist, all the way to your arm. And then as you add the torso bending away, you should start to feel a stretch in through your pec muscles as well, right? So again, this stretch is theoretically what it's doing. It is opening up all the tight muscles that we develop with the chronic sitting that we do. And to add on to that, what I like to do is to do a basic neck stretch away like so. So when you do this, hopefully you can feel a bit of a stretch in through the front side of your neck, right? That big muscle kind of in through there. And remember always to do both sides. Doing both sides is really, really helpful in understanding which side of your body is a little bit tighter as well. But also, it's important to balance things out, right? So it's always good to do both sides. And again, with any of these stretches, I try to advise my patients as well, if you can do them 3 times a day, right? If you can focus on trying to do it 3 times a day, I think that's a really good goal, right? Because most of us kind of forget throughout the day to do any sort of stretching. So if you can do 3 times a day of these stretches, I think that's a really good amount to start off with. Sorry, I would like to do more Q&A kind of stuff, but today I think I'm just going to fly through these. So that's the next one. So that was the neck, forearm, chest combination stretch. Okay, so let's move on to the lower limb, because obviously most of the stretches that we've done so far is kind of on the upper limb. I'm going to move on down to the lower limb now. Sorry, I'm just going to move my body just a little bit here. Okay, so the lower limb, what we're going to do, the first one is going to be a glute stretch. And this one's particularly good for those of you who might have one-sided lower back pain or one-sided hip pain or anything like this. All we're going to do is our foot is going to kind of come up onto our opposite knee. So let's just do this. There we go. Okay, so this is the starting position here, right? Some of you, your legs might be kind of up through here because your hips are a little bit tight. And some of you might not be able to go down this far like this, but that tells you that you've got some tightness in your hip, because this position should be a normal position where the legs are kind of parallel with the floor. Now from here, all we're going to do, our chest is not going to collapse down like this. Our chest is going to push forward, right? We're going to start to push forward like this. Now, as soon as you guys start to do that, you should start to feel a stretch on the side where the leg is up. Okay, so this one is my right hip, my right leg is on top of my left leg, and when you start to kind of pull forward, you should start to feel a stretch in through that right hip. And again, let's do both sides. Let's try the other side. Sitting up nice and tall, especially if you're very flexible, it's important that you sit up nice and tall. And then again, chest doesn't go down, it pushes forward. Push forward. And then you should start to feel another good stretch in through the opposite side. So now another common question I might be getting is how often or how frequent and how long should I do the stretches for? I think the hip one, you don't have to spend like 5-10 minutes on these. the most important thing is that you try to do it frequently throughout the day. That's the most important thing. Even if it's 30 seconds each side, even if it's, I don't know, 15 seconds each side, I think the frequency and how often you do it in between the days is much more important than how long you do it for in that one period of time. Yeah. Okay, so that's the glutes. So I'm going to show you guys maybe 1 or 2 more stretches that you can kind of do at your desk. In terms of sitting at your desk, those are probably the ones that I can do. These other ones, we're going to do a little bit of standing, right? So the next one is going to be for our hip flexors. Sorry, I keep moving around, but so again, when we're talking about opposites of our body, when we sit like this, you can see how in through our hip here, it creates a little bend, and this area kind of gets compressed a lot throughout the day. So we're going to do the theory of balancing opposites again. So what we're going to do, we're going to stand up, and it's a very common and basic hip flexor stretch. So all we're going to do is, so for this one, what we're going to do, one foot goes forward, the other leg is going to be straight, right? The other leg is straight, and you can see my foot is pointing straight forward as well. And all from here, you can go hands on hips, and we can gently just bend the front knee forward. And you see how my leg is still straight at the back? Yeah. Pull it forward, and the back heel can come off. Yeah. The back heel can come off, because otherwise you might feel a stretch in your calf there. The back heel can come off, and we just slowly lunge forward like so. And you should start to feel the stretch on the back leg at the front of your hip. Yeah, just like that. Same thing on the other side. Back leg is straight, heel can come off, the front leg drives forward. Yeah, and you should start to feel a big stretch through the front of your hip there. So that's the first one. That's the first one. The second one is going to be using our chair. We're going to do a little hamstring stretch as well. So hamstrings is the muscles through the back of our leg. Again, what we're going to do is we're just going to place our foot on a chair, leg nice and straight. And all we're going to do with our same side arm, we're just going to slowly bend down and back. Yeah, slowly bending down and back. This one, when I talk to a lot of patients, or when I assess a lot of patients, this one can be quite painful and quite tight. So with all these stretches, go nice and slowly. Go nice and slowly. Like I've mentioned before, a little bit every day is the key to you feeling better. It's really hard to make big changes or get rid of pain or discomfort if you just do it once or twice a week. So I highly recommend whatever stretch regimen you might have, just stick with it for 2 weeks, and then hopefully you start to feel a little bit better. But in terms of stretching at your desk, these are probably the most basic and easy ones that I give to most of my patients as well. And I hope it really helps some of you guys here today as well. And that's already 15 minutes. So, thank you for you guys who joined today. Before I go, I'm just going to note that our next webinar is going to be our bitter versus sweet webinar. And that's going to be on the 3rd of November. And the link to book for that one is going to be in the chat as well. So if you guys are interested in these 15-minute kind of webinars, make sure you join the next one. And hopefully we'll see you guys then. And thank you for your time today. Really appreciate it. Thank you.
Thank you, Jay.
No worries.